In this video, I'm going to talk about the mechanism of action as well as the clinical use of different monoclonal antibodies. So here I have the list for you, and I agree that it would be really hard to associate every one of them with their mechanism of activity as well as their clinical application. So for every one of these monoclonal antibodies, I have come up with a memory aid that will help you with their memorization. So the first monoclonal antibody is Omalizumab, which is used for the treatment of asthma, and the way it works is that it inhibits binding of the IgE to the mast cells as well as basophils, and thus it prevents the degranulation and the release of histamines. So the memory aid that I have for you here is that Omalizumab acts on the mast cells. So just think of that. Omalizumab acts on the mast cells to prevent their degranulation, and thus it's good for the treatment of asthma. The next medication is Abciximab, which is an antiplatelet and is used for post-angioplasty procedures, and the mechanism of action of it is that it inhibits the glycoproteins 2B and 3A. So the way you can associate these glycoproteins with this medication is that A is the first alphabetic letter, B is the second alphabetic letter, and C is the third alphabetic letter. So here we have the second, third alphabetic letter associated with Abciximab. The next medication is Mono-clonal CD3, and as the name implies, it binds to the CD3 antigen, and thus it prevents rejection in renal transplants. So once you know the name, the full name is called Mono-clonal CD3, it's easy to know that it blocks the CD3 receptor. Next we have the Trastuzumab, and the memory aid that I have for you is that Trastuzumab and show her breast. So Trastuzumab goes for Trastuzumab. So Trastuzumab. And then this medication is used for the treatment of breast cancer, and it acts by acting as a HER2 antagonist. So Trastuzumab and show her goes for HER2 breast. Next we have the Rituximab, and the memory aid that I have for you is the name Renon. So Rituximab inhibits the non-Hodgkin lymphoma, so Renon, and then it acts by acting as a CD20 antagonist. Then we have another medication that you have to memorize them together. So every time you think of Infliximab, think of both Infliximab and Adalimumab. So both of these medications are used for the treatment of Crohn's disease as well as rheumatoid arthritis, and they act by inhibiting the TNF-alpha. So Infliximab and Adalimumab. And the memory aid that I have for you here is that Infliximab, so INF, it has similar name to TNF. So Infliximab as well as Adalimumab inhibit the TNF. And then you should also know that patients that are receiving Infliximab, since there is inactivation of macrophages, there is an increased risk of activation of latent TB. And thus you should first provide them with a PPD skin test to make sure they don't have tuberculosis, and then you can provide them with this medication. The next monoclonal antibody that we have is Palivizumab, and the way that you can memorize it is that Palivizumab inhibits the RSV virus. So here we have the Palivizumab VI inhibits the RSV virus. The next medication is Eculizumab, which inhibits the complement-mediated hemolysis by inhibiting the C5, and it's used for the treatment of paroxysmal nocturnal hemoglobinuria. So the way I memorize it is that eclipse at night. So Eclipse goes for the name of this medication. Eculizumab has a similar name to Eclipse, and it's used for the treatment of hemolysis at night in patients with paroxysmal nocturnal hemoglobinuria. So Eclipse at night. The next medication is Bevacizumab, which prevents angiogenesis by inhibiting the vascular endothelial growth factor, and thus it's good for the treatment of solid tumors like patients that have colon cancer. So the memory aid is Beverage for the colon. So Bevacizumab is used for the treatment of colon tumors. And then finally we have Natalizumab, which binds to the integrin on leukocytes, and thus it prevents the migration to inflamed tissues, and thus it's good for the treatment of multiple sclerosis by preventing the inflammation. And the way I memorize it is that Natalie has MS. So Natalizumab is used for the treatment of multiple sclerosis. And that concludes our discussion.